Hi, I'm Loretta Bush, President and CEO for Authority Health. And this month, we are recognizing Alcohol Awareness Month. I'm here with Dr. Hussein Saghir, and we're going to have a conversation about alcohol, about how COVID has affected the consumption of alcohol, and then most importantly, what we can do to recognize the signs and get screened and get help for ourselves or for others if we find that alcohol use and overuse and abuse is an issue for us. Thank you, Dr. Shagir, for joining me today.
Thank you for having me.
All right. So let's talk about the effect on COVID. You know, probably me, like everyone, we look forward to the day when we won't have to talk about how COVID is impacting other things. But that day isn't here yet. So we know that as Michigan and other states, as we enacted certain restrictions, stay-at-home orders, and then still work in place, there was a study that showed that there was a 54% increase in the national sales of alcohol. And that increase occurred in March of 2020 compared to the year before. And online sales increased by over 250%. Talk to us, Dr. Shagir, about your thoughts about what has caused this increase over the past year.
Well, that's a really good question, Loretta. There are a few different reasons that are contributing to the increase in alcohol consumption and purchases. And the pandemic has played a huge part of it. And that includes, increased drinking due to stress about the uncertainty, what's going on. There's an increase in alcohol availability,
Yeah.
and boredom. Participants in that study were reported being stressed by the pandemic, consume more drinks over a greater number of days, which raises concerns from both an individual and public health perspective.
You know, that's incredible. And, you know, I don't think that the fact that that many times we make light about drinking, right? I know that over the past year, I've heard things like, well, it's 5 o'clock somewhere. And in the past, when that was said, you know, it was funny. And but now I don't think that those kinds of things are serving us well now. And it's interesting when you say that people are doing it because of boredom.
Yeah, it really has created a societal problem. I mean, people are just, you know, not working as much or not in their workplace. They're spending a lot less time in these structured environments. And in some ways, that's been a positive thing, but in a lot of ways, that's also been a negative. And so, boredom, especially even among younger cohorts, you definitely see that kids aren't actually in their, going to class, even if they're in college, they're doing more of the remote learning. And so it's really created a societal, I think, imperative to address alcohol use and, what we can at least do to it. And I think that it's a really good point to kind of address this beyond, the joke or the, hey, that's all I'm basically doing, and just kind of have a frank conversation, because a lot of people are hurting. A lot of people share these substance use disorders, especially right now. So
Yeah.
I can't think of a better time to be talking about it.
Absolutely. And I think you've hit it on the head when you said a lot of people are suffering and they're suffering in silence, and kind of we can hide behind the joking, right? And the social acceptability of alcohol. But many people are gonna have already found themselves in trouble and will certainly find themselves in trouble as we emerge out of this and we're coming out of our homes and we're interacting more.
Absolutely.
Well, let's talk about women for just for a few minutes. So there was another study. I think it was the American Medical Association, the Journal of the American Medical Association, that found that there was a 41% increase in consumption, alcohol consumption among women. So that turns out to be about 1 in 5. What does that say about the impact of this pandemic on women?
So women in a lot of ways are bearing the social and economic brunt of this pandemic. 11.5 million women have lost their jobs during it.
Yes,
And this finding would suggest that women may be turning to alcohol more because the economic, social, and emotional impact has had on them. We know that people drink to be social, but when they cannot be social during the lockdown, they may feel anxious, stressed, and depressed, and will imbibe to self-medicate. So I think it's that self-medication aspect that we really need to focus on, and potentially offer more constructive ways, or at least a more constructive understanding to their use, and in that way try to address it.
absolutely. And, as it relates to women, let's stay on that for just a few more moments. So, this is something that I've heard in the past. Talk to us about the amount of alcohol for women compared to men. Isn't there like a different effect? Doesn't it take less for women